What your doctor checks in the first 10 seconds. Before your doctor asks a question, they are already checking you. Before the stethoscope, before your chart, the diagnosis has started. In the first 10 seconds, a trained doctor can spot signs of liver disease, low oxygen, heart problems, even cancer. Just by looking at you, you don't notice it, but it's happening every time. The diagnosis begins at the door. You walk in, the doctor looks up. In that moment, they are not just seeing you, they are scanning you. This is called the doorway assessment. Medical students learn this from day one. No machines, no tests, just eyes and training. They look at your skin, how you walk, how you breathe, your face, your hands. These are not random glances. These are fast checks built from years of experience. Many serious conditions are first suspected in these few seconds. Today, we go step by step through what your doctor checks first. By the end, you will understand what they see and you can check yourself too. Section 1. Your skin color. Doctor sees is your skin color, not your natural tone, but any change from normal. Small changes can mean big problems. If your skin or the white of your eyes looks yellow, that is called jaundice. It means bilirubin is building up in your blood. This usually points to a liver problem or blocked bile flow. A doctor can spot this from across the room. It is one of the fastest visual warnings in medicine. If your lips, fingers, or ears look blue, that is cyanosis. This means your blood does not have enough oxygen. This is serious. It can be linked to lung disease, heart failure, or even a blood clot in the lungs. When doctors see blue skin, they act fast. This is not something to ignore. If your face looks very pale or washed out, that is pallor. It often means anemia. Your body does not have enough red blood cells. Doctors will often check your lower eyelid. If the inside looks pale instead of pink, it is a strong sign of anemia. Red skin also tells a story. This is called erythema. It can mean infection, inflammation, or an allergic reaction. Sometimes it is simple, like skin irritation, but sometimes it points to deeper issues. Another sign is mottling. This is patchy, uneven skin that looks like a net or lace pattern. It can be red, blue, or purple. This often means poor blood flow and can happen in shock or serious illness. Doctors also look for what they call the ugly duckling. This is a mole or spot that looks very different from others on your body. It can be an early sign of skin cancer. This check takes seconds but can save lives. These checks are fast but powerful. In less than 10 seconds, a doctor can guess if your blood, liver, heart, or lungs are under stress. Your skin is not just covering your body, it is showing what is happening inside. But your skin is not the only thing giving signals. Your hands give even more details. Section 2. Your hands and nails. The next thing doctors look at is your hands, especially your nails. Nails grow slowly, so they show changes over time. They act like a health record. One major sign is clubbing. This is when the fingertips get bigger and the nails curve down. It looks like a spoon turned upside down. This is linked to low oxygen over time. It can mean lung disease, heart problems, or even lung cancer. Doctors often test this by placing two nails together. If there is no small gap, it may be clubbing. Another sign is spoon nails. This is when nails curve inward like a bowl. These nails are soft and thin. This usually means iron deficiency, anemia, or sometimes thyroid problems. Doctors also look for Beau's lines. These are horizontal lines across the nail. They show that your body went through stress or illness in the past. Nails grow at a steady rate, so doctors can estimate when the illness happened. Color is also very important. Pale nails can mean anemia or heart failure. Blue nails mean low oxygen. Yellow nails may point to infection or lung disease. Half white and half brown nails, called Lindsay's nails, can be a sign of kidney disease. Dark lines under the nail are serious. A new black or brown line can be a sign of melanoma, a type of cancer. This needs quick checking. Doctors may press your nail and release it. This is called capillary refill. If the color does not return in 2 to 3 seconds, it can mean poor blood flow or dehydration. They also check your skin, joints, and movement. Swelling, bumps, or stiffness can mean arthritis. Cold, dry hands may suggest low thyroid. Warm, sweaty hands may suggest high thyroid. Even a small handshake can show weakness or nerve problems. Section 3. Your eyes. Now the doctor leans slightly forward. It looks like normal eye contact. It is not. They are checking your eyes very carefully. Your eyes give a huge amount of information in seconds. First, they look at the white part called the sclera. It should be white. If it looks yellow, that is jaundice. This can appear in the eyes before the skin and points to liver problems or blocked bile flow. If the sclera looks slightly blue, that is not normal. It can mean weak bones from a genetic condition or low iron levels. These are small changes, but doctors catch them fast. Next, they check symmetry. Both eyes should look the same. If one eyelid is drooping, this is called ptosis. It can mean nerve damage, muscle weakness, or serious pressure in the brain. If only one side is affected, it raises concern. Then they check your pupils. Are they equal in size? Unequal pupils can mean brain or nerve issues. They also check how pupils react to light. Slow reaction can signal pressure in the brain or drug effects. They also check eye movement and the skin around the eyes. Yellow patches can signal high cholesterol. Section 4. Your gait and posture. From the moment you walk in, your doctor is watching how you move. This is called gait analysis. It starts before you even sit down. They are checking your steps, your balance, your speed, your posture, and your arm swing. A normal walk is smooth and balanced. Both sides move evenly. Your arms swing naturally. Your steps are steady. If something is off, it stands out quickly. If your steps are short and slow, and your arms barely move, this can be an early sign of Parkinson's disease. This pattern can appear years before visible shaking starts. Doctors can detect this just by watching you walk a few steps. If you walk with a wide base, like you're trying not to fall, it suggests balance problems. This often points to the cerebellum, the part of the brain that controls coordination. Damage here can come from stroke, alcohol, or disease. Many patients do not notice it early. If you limp or favor one side, it can mean joint pain, muscle weakness, or nerve damage. People often adjust slowly over time, so they do not feel the change, but doctors see it clearly. Doctors also check posture. Are you standing straight or leaning forward? A forward lean with rounded shoulders is common in people with breathing problems. A curved upper back, called kyphosis, can mean weak bones or small spine fractures. They also look at speed and arm movement. Walking too slow or uneven or reduced arm swing can signal deeper issues. Section 5. Your breathing and voice. The moment you start talking, your doctor is listening very closely, not just to your words but to how you breathe and how your voice sounds. First, they watch your breathing. A normal breathing rate is 12 to 20 breaths per minute. If you're breathing faster than that, even slightly, it can signal a problem. It could be infection, anxiety, heart issues, or metabolic changes. Doctors often count your breaths while pretending to check your pulse, and you do not notice it. They also look at effort. Are you using extra muscles in your neck or chest to breathe? Are your nostrils flaring? This means your body is working harder to get air. This can happen in asthma, lung disease, or airway blockage. They listen for sounds. Wheezing means narrowed airways. Stridor is a high sound that can mean blockage in the upper airway. Gurgling can mean fluid in the airway. These are warning signs. They also check if your chest rises evenly on both sides. If one side moves less, it can mean lung collapse or injury. Now your voice. A hoarse voice can mean irritation or pressure on the vocal cords. Sometimes this is linked to thyroid problems. A nasal voice can mean blockage in the nose or sinuses. A weak or breathy voice can mean nerve damage. Slurred speech is serious. It can be a sign of stroke, and doctors react fast. They also notice how you speak. Fast speech can point to anxiety or high thyroid activity. Slow speech can suggest low thyroid or depression. They also check if you can speak full sentences. If you stop often to breathe, it may mean your lungs or heart are not working well. This quick check helps doctors decide if you're stable or in danger within seconds. Conclusion. Now you can see what your doctor sees. Skin, hands, eyes, movement, breathing, voice, all checked in seconds. No tests, no machines, just training and observation. 10 seconds, that is all it takes to get the first picture of your health. Your skin shows your blood, liver, and oxygen. Your nails show your lungs, kidneys, and nutrition. Your eyes show your brain, cholesterol, and nerves. Your walk shows your muscles, joints, and balance. Your voice and breathing show your lungs, heart, and brain. This is what years of medical training look like. It looks simple, but it is not. It is fast pattern recognition built over time. Your body is always giving signals. Doctors learn to read them. Now you can start noticing them too. If you want to understand your body better, check what your fingernail shape says about your health. That video is next. And if you missed what your eyes can reveal about disease risk, watch that one too. See you in the next video.